Every day, covering health and wellness in this country, I meet one person who tells me that their life has changed because of GLP-1. But every day, there is also a headline. There is also a lawsuit. I want to understand your perspective. How is the industry dealing with it? And what are you then doing for responsible consumption?
First, I want to talk about what these drugs are. These are prescription medications that should be prescribed under the supervision of an endocrinologist or an internal medicine for someone who is obese or has diabetes. Full stop. So we do not promote this for cosmetic weight loss or anything else. When I hear challenges, what I would say is give two perspectives. One, I think this is a very interesting time in India right now to focus on health. We think about obesity. There was just a analysis in the Lancet that said there are 440 million people in India that are at risk for being obese. We know the consequences of obesity and diabetes. I think it's important to note that when you hear those numbers, we still know that obesity does not get the awareness, there's not the early diagnosis, and there's a stigma so patients don't actually reach out to physicians. And I think that's where we as a company believe we promote to our label. We do not promote or condone any use that is off-label, but we also believe that there are more voices and more collaboration between us, healthcare providers, government, and so forth that needs to raise awareness around obesity and diabetes. So we're all about responsible use of these medications. And to date, while these products are being used broadly, they're being used in a very small fraction of the patients who ultimately could benefit from them.
Dr. Lakdawala, I want to understand this from you. A lot of people still think of GLP-1 drugs as a shortcut. I've heard this criticism time and again. Every time there's a campaign that goes out with a celebrity, Serena Williams was the latest one, everybody said it's a shortcut. Do doctors like you see it as a shortcut?
As far as the shortcut goes, I would say that obesity is a chronic disease. The moment you say chronic means it does not go away. And ask anybody who's trying to lose 5 or 10 kilos, how difficult is it to maintain that weight loss? And therefore, if someone's with 40, 50, 60 kilos more than what they ought to be, it's always going to remain a lifelong challenge. And therefore, anybody who's looking at a shortcut solution for obesity, which is a chronic disease, I think is talking about something completely different. So if you're looking at a chronic long-term disease, the options have to be long-term, not shortcuts. Shortcuts will never work. That's why a diet or a lifestyle change which will last you a lifetime rather than for a month or for a season is always going to work.
I often think of it as these drugs at the moment are not perhaps for everyone. These are people who are affluent, who can afford it, who can perhaps manage to make it. If this has to be a movement, and we've spoken about it earlier, what can the industry do to make it more affordable? Because obesity, like I said, even with the UNICEF report, it's not the problem of the rich. It's not a Sobo problem or a South Delhi problem anymore. It needs to go everywhere.
So I would answer that in two ways. One, there are innovator GLP-1 products today, and the pricing of those are based on multi-factors. The efficacy of the product, the impact that it has on health costs for the system, the impact it has for a patient, and so forth. And so that's what's included in that. As a responsible company, we are focused on reducing the burden of obesity worldwide and in countries. Now, that's the innovator portion of GLP-1s. There will also be a generic portion of GLP-1s as well. And so there'll be expansion of that. In addition, I think that GLP-1...
How soon?
I can't talk about other products, but I will say that there will be generics of GLP-1s that will enter the market at some point. In addition, we are investing in a pipeline of products that are GLP-1, GIP-1, and glucagon receptors, because we believe that these different products will have different effects on blood glucose, on weight, and it will give clinicians tools that sometimes these products may be synergistic, that they can then personalize treatment for patients. And I think you heard, and patients are now looking for reduction in glucose, reduction in weight, but also looking at what can these products do for them in making them feel better.
Also, reduction in complication. Currently, it's still a shot. It's a pen. It's still an injection. How soon? I know Eli Lilly has done phase 3 trials already in the US. How soon can we have a pill?
Sure. What I want to just first start saying is, yes, you're talking about our pipeline of an unapproved product yet, which is a pill. So we are doing studies on that. As that comes forward, we will look to bring that to India as well. And if approved, I believe that product could have great promise for patients in India, particularly because we know that injections are sometimes not as easily accepted across the population.
Right. If 2025 was the year of introduction of weight loss drugs, 26 perhaps is said to be the takeover, where the pills are going to be available, it will be much cheaper, a lot of other brands will get in as well. What is your hope that GLP-1 will do to India and the world?
I'm going to speak about India. I can tell you in the world, we are seeing these products be used globally, and because there's more of awareness, we're seeing them be uptake more by physicians and appropriately by patients. In India, we have a lot more work to do to take away the stigma. I would like 26 to be the year in which patients take action by going to see healthcare professionals, and if diet, exercise, and medication is indicated, that they appropriately get access.
If you like the video, do like, comment, share and subscribe.